Good morning and welcome to another edition of the Senate Committee on Commerce and Labor. Madam Secretary, please call the roll.
Senator Buck. Senator Daly. Senator Hammond. Senator Lang. Senator Pazina. Senator Scheibel. Senator Stone. Chair Spearman.
Here, and please mark Senator Scheibel present once she attends. And again, for those of you who may not be familiar with this time of the year in the legislature, many of us will be moving in and out because we have bills in other places. And so if you see somebody get up and walk out and they've got the scowl on their face, it's not you. They're just getting ready to testify or listen to a work session, okay? I want to welcome those of you who are joining us here in Carson City and those who are joining us in Las Vegas. And obviously, you know that there are 4 different ways in person here in Las Vegas. You can submit written comment, or you can go to the legislative website and share your opinion. Please, 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 ma'am, please, sir, when you come to the table, please make sure that you turn your microphone on, speak into the microphone clearly, and when you finish, please turn your microphone off. Reminder to those who are testifying pursuant to NRS 218E.085, a person who knowingly testifies and misrepresents facts during testimony to a legislative committee is guilty of a misdemeanor. Myself or any of the committee members can ask you for documentation to support your testimony. And so with that, we have one of our members not here. So Assemblywoman Kasama and Assemblyman Carter, if you all need to leave, feel free to do so. We're going to start with a bill hearing first, and then once we have a full complement, then we'll do the work session, okay? And so with that, we will start with Assembly Bill 250. The measure establishes provisions governing prescription drugs. Welcome. Lieutenant Governor, I think this is the first time you've been in front of one of my committees. Welcome. This is an honor. Thank you.
Kate Marshall, honey, I'm always before you.
Oh, you got the memo too. Flattery gets you everywhere here, so keep talking. Okay, you all can begin when you're ready.
Good morning, Chair Spearman, Vice Chair Lang, and members of the committee. I am Venetia Considine, and I have the honor of representing Assembly District 18. I want to thank you for your time and opportunity to present Assembly Bill 250 today. My co-sponsor on the bill, Assemblywoman Anderson, is unable to join us today because she is in the Ways and Means Committee. However, I do have another co-sponsor or someone participating with me today. I have Kate Marshall. She is the senior advisor for with the Impact Project with the Hopewell Group. She's the former lieutenant governor and was senior advisor to governors, special advisor to the governors in the White House for a time. She is here with me today to help answer questions and go over Assembly Bill 280. 250. I'm sorry, 250.
Don't confuse me.
Thank you. I apologize. Okay. So this bill is about people. You're going to hear a lot today that doesn't have to do with people, but I want to start talking about this bill because it centers on people who have life-altering and life-changing health issues that are often unable to afford their prescriptions. They sometimes don't take the full amount of the prescription. They sometimes cut pills. They sometimes skip taking them altogether, even when they have a health issue that requires daily prescription taking. This bill is about taking the opportunity to provide relief to certain Nevadans that are facing those financial issues. Most, if not all of us, have dealt with life-altering health issues. If it's not us, it's our family members. The point of this bill is to provide prescription drug relief to Nevadans. I've had numerous conversations with stakeholders on this bill. I've listened to their worries. In thinking about this bill over the weekend, I also realized a lot of those conversations seem to be magical in a way that it's a sleight of hand in my perception. I'm bringing this bill to provide relief to people. And what I hear in talking with stakeholders and talking with the industry is that this bill is the end of private research and development. It's not us, it's them. It's going to just cost shifting. And if you do this, we'll just have to charge more for other things, which is what I think the definition of cost shifting is. That we should be fixing the system first, but not now because there's too much going on. It's not us, it's the PBM. It's not the PBM, it's the insurance company. It's everything back and forth. If you do this, we will lose profits. And I find that interesting because drug companies are reporting record earnings, yet they're still hiking prices that Americans pay for the drugs that we need to survive. Reuters reported that 5 of the largest drug companies in the world will hike the prices of more than 350 drugs in 2023 alone. Over the weekend, I read a piece in the New York Times that prescription drugs cost, on average, over 2.5 times less outside the U.S. than they cost in the U.S. The article also talked about some of the pharma giants assigning patents and other forms of intellectual properties to overseas subsidiaries to game the tax system, essentially having their profits in a lower tax jurisdiction, making the profits disappear here and reappear in those lower tax jurisdictions. In all of these conversations that I have, what I don't hear, or what I rarely hear, is how do we help the people who can't afford their prescriptions? And that's what AB 250 does. Before I explain the mechanics of the bill, I would like to ask Ms. Marshall, Lieutenant Governor Marshall, if she would talk a moment about her own experience facing a life-altering health situation and having to balance your family's needs with the cost of some of these life-saving drugs.
Good morning. Kate Marshall for the record. I don't normally explain, how one's personal life goes and medical issues, but Venetia had the opportunity to hear that and asked if I might tell you about it in terms of how as a family you think about cost. In 2016, I was diagnosed with cancer. Perhaps because of the age I am, I assume that was a death sentence. It was not, as you can see. We have a lot of opportunities and therapies available to us. The cancer had advanced, and so I needed to get into surgery immediately. By the time I got into surgery, it was Easter when I got the diagnosis, and it was Mother's Day when I went into surgery. And by the time I got out of surgery, we had hit our annual cap. That was not the first time I hit the annual cap. When I got out of surgery, I was told that I would need chemo. However, there was a company in California. I think there is more than one company now, but there was a company in California that could test the DNA of the tumor and provide a ranking between 1 and 100. If the ranking was below 18, I wouldn't need chemo. However, that DNA testing of the tumor was not covered by insurance. Well, one of the things to understand is that when you reach your annual cap, then depending on your insurance, it can be 80 or 20 or 70 or 30, what you continue to pay unless it's not covered by insurance. The cost of that DNA tumor was $8,000. Mind you, we had already hit our annual cap. Mind you, my husband's a economist, and I love him dearly, but he is a frugal man. I shouldn't say but. And we were cleaning out our savings at a pretty quick rate. I called them. I don't know why I called them. I just called them because I don't know what to do in those situations. And I don't know, what do you do? Do you put it on your credit card? Do you tell your husband? Do you tell him later? I was worried. I sat down with my husband. I said, I think we need a divorce so that you can have the house. And he said to me, I don't think that they take your house anymore. That wasn't the first instance. We came up with the funding for that, and my number was 17. It meant I didn't have to get chemo. It's life-changing. However, I did have to take medication. The first medication I took had me turn into a ball, and I would wake up in the morning and I'd have to unfurl myself. To get up the stairs, I would have to literally pull myself up the stairs. And I said to the oncologist, do you think maybe there's another medication? I don't know. I mean, if this is what I have to take for 5 years, okay, but is there another one? Well, there's some, but then pretty soon you're going to get to ones that are not covered. And then because you're taking this medication, you go into the oncologist's office and they tell you, you need to go to the billing department first. By now, I've hit my annual cap a second time. You don't get to see the oncologist. Go to billing first. I go to billing and they tell me that I need some kind of other thing so that I don't get osteoporosis because the drugs I'm taking accelerate bone loss. But it's not covered by insurance. I don't have to take it. So I'm sitting there thinking, well, I want to survive the cancer, but I don't want to then, do I break a hip? How do you balance these? Well, you want to say, okay, I'll take that medication. So I'm sorry, I get a little emotional, but what I'm trying to explain to you is that you're going to hear from a lot of people about a lot of things. At the end of the day, this is about someone who is sent to the billing department, who needs medication. There's no competition for that medication. Can we please begin the process of pulling down the prices for people? I wasn't 65, I'm not 65. I don't have the chance for Medicare. I have the state's health care plan. It's a good plan. Thank you.
Thank you. AB 250 is designed to reduce the cost of certain high-cost, non-competitive, life-changing drugs, prescription drugs, by extending the benefits of the federally negotiated Medicare drug prices that were made possible under the Inflation Reduction Act. The extension would be to all Nevadans. So whether you're 59 facing breast cancer, you are 65, 67 already on Medicare, or you're 14 and you have a disease that requires one of these non-competitive drugs to make you healthy again, you all pay the maximum fair price. The Inflation Reduction Act had a requirement that pharmaceutical companies work with Medicare to find a maximum fair price. Up until the Inflation Reduction Act, I believe it was unlawful to negotiate drug prices only in this country. The fact that they are Medicare and the pharmacy companies will negotiate maximum fair prices for up to 50 life-altering, non-competitive drugs is why we are sitting here today. The first 10 drugs that we think they may be are this list that you should have in front of you. Gives you an idea of what these drugs can cover. We don't know for sure if these are going to be the 10, but the 10 drugs, the goal is the highest cost to Medicare, the highest use drugs, and those with no competition. And there were 50 originally selected. 10 drugs will go into effect in 2026. Those drugs will be determined this September. The prices will then be negotiated by next September, and the maximum fair price will go into effect in January of 2026. Although our Senator Catherine Cortez Masto and Senator Klobuchar have a bill in the Senate right now to actually speed up that timeline. I don't know where that will go, but that is what they are working on. Once those are determined, what we would like to is already have the infrastructure here, that if you're on Medicare, you will automatically get that maximum fair price. But if you are not on Medicare, that at the point of sale, when you need to buy these drugs because your doctor has prescribed them for your life-altering health issue, that you pay the maximum fair price, or if your insurance company has worked out with the PBMs a lower price than what that maximum fair price is, you retain the benefit of that lower price. We are not changing anything that's been negotiated to a lower price. That is essentially what this drug does. There are approximately 565,000 Nevada seniors, about 70% of the state's population, 17%, thank you, of the Nevada's population enrolled in Medicare. That's out of 2.5 million in this state. They will soon enjoy the benefits of these negotiated prices, and in 2027, the Inflation Reduction Act will allow 15 more of those drugs to be listed, and 15 more the year after that, potentially reaching up to the 50 that are on the list. So this will be sort of a rolling list of prescription drugs, provided the maximum fair price ceiling. But the rest of us, unless this bill passes, the rest of us will be left facing the full amount of the amount that the pharmaceutical companies, PBMs, and insurance companies can charge us, which can put those life-changing medications we need out of reach. It will cause people to have kitchen table discussions about whether or not we want to hold on to our house, whether or not we want to save for our children's college education, whether or not we want to invest in a family member's health at the expense of the rest of the family. But AB 250 can change that by applying the negotiated prices of pharmaceutical drugs under this Medicare system to Nevadans who need them. To go over the bill, starting on page 3, there is an amendment. You should have the amendment, and that will be taking out subsection 8, which I'll talk about in a second. A person or entity that purchases a reference drug on this list in Nevada shall not pay a price for the reference drug that, excluding any fee paid to the pharmacy for dispensing or the reference drug, is higher than the maximum fair price for the reference drug during the price applicability period. So essentially what this means is that whether or not an entity or a person who goes to a pharmacy, they're in their doctor's office, wherever they are buying this drug, they are paying either a lower negotiated price, or if they don't have one that is lower, they are paying the maximum fair price. If they go to the pharmacy or the doctor, any physician's fees, pharmacy dispensing fees, we are not touching those. We are only touching the cost of the drug. If they do pay a price that is higher, then the entity or who sold it is in breach of a deceptive trade practice, and there is a private right of action for people to enforce that. Also, these drugs are only this price during the price applicability period. So if for some reason a drug falls off of this negotiated list with the federal government, Nevada will follow suit with that as well. The definitions for maximum fair price. and definitions. Other definitions are already in the bill, so I don't need to go over them. Essentially, this drug provides relief. Our initial draft of this bill provided the relief to everyone, although we had an opt-out, we had an amendment that took the unions out to create them to be opt-in because of some discussions that we had with the unions. However, after hearing that some unions were not interested in solving this by excluding the unions, the amendment, which takes out subsection 8, does put the unions back in so that it does cover every Nevadan in the area under these drugs. And if you have any questions, I'm happy to answer those questions. Thank you.
Thank you. Let's go to Senator Daley and then Senator Pezzina.
Thank you, Madam Chair. A couple comments more than an actual question. I'll comment first on the ERISA language that you took out. My understanding is that under the Inflation Reduction Act, which allows the government to now negotiate for prescription prices, which I won't use the same words that then Vice President Biden used about it being a big deal, but it's a big deal when we're able to do that. My understanding is because it's under federal law, and when those things go into effect, the ERISA plans would not be exempt anyway, so having language that potentially conflicted with that. So I think it's the right move to take it out, regardless of what anyone else thinks. I believe that's the structure of it. And, I've gone back and forth on this particular bill as well, and some of the things you said, and thanks for the personal story. And you're right, we don't know what's going to happen. We don't know which drugs are going to be on there. There's a lot of moving parts on how this all works. People are familiar, I think, with the bell curve. If you price something at 30% and 70%, you collect the same amount of money. Right now, it's where demand meets the cost. To maximize profit is what they're doing on these drugs that have no competition. So if there's an opportunity, and we'll see how it all works out, on getting these drugs into a formulary on many different plans as they can, they may increase the volume, which keeps them at the same income levels, various things. And nobody knows for sure how all that's going to work out. But the government's moving forward that way, and I know a lot of our plans when we negotiate preferred provider contracts and various things, we're setting the reimbursement rate that we'll have so we can attract providers so our people can get treatment at whatever Medicare will pay plus a percentage. And that's just the way the system is. It's a for-profit system, and we all have to deal with that. So I'm not saying that this is necessarily a bad idea, but time will tell if it's really going to work. Either way, the federal government is going to negotiate prices for the first 10 and then the next 10. And then how this fits in with that, I think is going to create more opportunity than harm, and everybody will adjust from there. So just comments, not really a question. And I thank our former Lieutenant Governor. I spoke to her over the weekend regarding some of this stuff, and have my concerns, but I think we got to move forward.
To Senator Daley, through you, Chair Spearman.
Just go direct.
Thank you. This is Venetia Constein for the record. Thank you for those comments. Bringing up two things, I appreciate those comments a lot. For me, this is an opportunity that has not presented itself before to provide relief to Nevadans that I believe we need to jump on. We need to run. This is a movement. We need to go with this movement. The drugs that are on these lists, if they are non-biologic, they must be on the market for at least 7 years with no competition. And if they are biologic, at 12 or 13 years at least. So just to talk back to the profit, so there is time to make up that research development, there's time to make up that profit. Also, talking about profits and talking about competition. Our country is based on competition. Businesses do better when there is competition. Prices lower when there is competition. When volume goes up, prices come down. These drugs currently do not have competition. However, opening this opportunity for all Nevadans to access these drugs when they are prescribed by their doctors means that insurance companies can potentially take them from off the list because they are too expensive to possibly on the three-tier system that was mentioned by my co-presenter, whereas, okay, right now you have this, but it is too expensive for you to jump to this, even though that might be the best option for you. So you're gonna need to start at tier 1, which is a lower cost drug, which might not work, but then we have to have you go through this lower cost drug that might not work. And if it doesn't, then we go to tier 2. And if that one doesn't work, then we go to tier 3. All of these having costs, financial costs, mental costs, physical costs. If these maximum fair prices are low enough that insurance companies utilize these by lowering the tiers, that saves multiple levels of additional costs, while at the same time upping the volume, going back to the senator's point about increasing profits. So thank you for allowing me to jump off of your statement. Thank you.
Thank you, Senator Pazina.
Thank you so much, Chair, and thank you so much for the presentation, Lieutenant Governor. It's always wonderful to see you, and thank you very much for sharing your story. I had a question in regards to Section 1, Sub 3, about maintaining in the state a base of operations, and it was really hearkening back to AB 107. So you may have already answered this, and I apologize if you did because I didn't watch the Assembly hearing. But I was curious if AB 107 had any conflict with this. We just work sessioned it out of this committee last week. So that's my question. It doesn't need to be answered today. You can get back to me, but I thought you might have already addressed that in the Assembly. And thank you.
Thank you, Kate Marshall, for the record. Thank you, Senator Pazina. Where are you on the, I don't see where you are.
So I'm looking at Section 1, Sub 3, except as otherwise provided in subsection 8, a person or entity that sells, offers for sale, distributes, or delivers any reference drug to a person in this state, or seeks reimbursement for a reference drug which is delivered, dispensed, or administered, shall maintain in the state a registered agent in office or base of operations. And with AB 107, I think we were looking at maybe those providers that were outside of the state being able to help those in the state. So I just didn't know if there was a conflict. And again, I don't need an answer this moment, but I thought it may have been answered in the Assembly. And thank you.
Yep, Kate Marshall for the record. So the reason this is in there is because as when I was state treasurer and when I was lieutenant governor, the Secretary of State, whoever he or she may have been at the time, would always berate you if you didn't have the business registered in Nevada. And so it's a PTSD thing. I have to put in there that the business gets registered. So if you have a bill in front of you where you no longer require that, or you have some other means by having some oversight, we're totally fine with that. It's a tick. It's a tick. Just tell Cisco Aguilar, tell the Secretary of State I acknowledge. Thank you.
Thank you, Senator Pazina. Venetia Constein, for the record. It was not brought up in the Assembly, so I was unaware of AB 107, but I will review that today and get back to the committee if the chair likes.
Thank you, Senator Stone.
Thank you. Good morning, Chair, and good morning, Lieutenant Governor. And thank you for sharing your story, and Godspeed, that you should stay in good health moving forward. And to Assemblywoman Considine, I want to say that I appreciate your efforts to try to contain drug costs, which are and can be expensive. And I appreciate the time that you gave me. We spoke on the telephone about your bill and about some concerns that I have with the bill. So let me start with maybe some of the things that we talked about. So first thing I'm going to talk about is federal patent laws. And I know some of this stuff, as many of you know, I've been a practicing pharmacist until recently for about 42 years, owning 6 pharmacies and dealing with buying drugs directly from manufacturers and buying drugs through wholesalers. So the first thing is that when a drug company files an application, a new drug application, that's when the clock starts ticking for their patent. And today, the patent is 20 years from the date of application. So sometimes it takes 5, 7, 8, maybe longer years to get a drug on the market. So it's only that delta that they get the patent protection. And I appreciate what you say about competition. But if we didn't have these patent laws and give them basically monopolistic tendencies with these new drugs, then they would never get a return on investment and take the chance on spending sometimes billions of dollars developing new drugs for things that I know that are important for all of us, such as cancer, autism, better care for people that have hepatitis. And these laws are federal laws. So we have a supremacy clause of the Constitution that's at stake here. And what you are trying to do here today has actually been tested. The District of Columbia wanted to have price controls, and it went all the way to a federal court that overturned their law, saying that it is the purview of Congress to determine whether there are any discounts to drugs or not, and the negotiability, if you will, with drug companies. So that's the first concern, is the legality of what you're trying to do. The second thing is that, assuming that you do get the bill passed and into law, there are more concerns. One, a lot of people are covered by insurance. What's the guarantee that the insurance company is going to pass that delta on to the patient in the way of lower cost or lower copays? And then if the law is passed, me as a pharmacist, I don't negotiate with my wholesaler except for the discount that I get or the cost plus that I get with the wholesaler. There's a couple of companies that may still allow me to buy direct from a wholesaler, and the advantage of a pharmacy buying from wholesalers, if you pay your bill on time, they give you a 2% discount, which can kind of help you with the low fees that exist today. So your bill is kind of targeting a pharmacist that if they're unable to buy a drug at the price that you are advocating for, then if they don't sell the drug at that predetermined discount, then the pharmacist can be held liable through a private right of action for deceptive trade practices. And I'll tell you that most pharmacists don't have deep pockets where they could sustain a lawsuit like that. And so what I see as a response to this, if it were to become law, is that pharmacists will not be able to buy at this discount because the drug companies are not going to lower the price. And pharmacies are just plain not going to stock the drug, and they're going to tell the patients, we don't stock it. And by the way, there's no law that mandates that a pharmacist dispense any prescription. We can refuse service for any reason we want. Somebody comes in with multiple prescriptions for Vicodin, we can say, sorry, we're not going to fill this. We think your frequency is too much. Or somebody comes in, there's a drug interaction, they still want it, we say we're not going to dispense it. Or for whatever reason, the pharmacist says you have to give a reason, we're sorry, we can't fill your prescription at this time. So here's the questions. One, how are you going to overcome the supremacy clause of the federal Constitution? Two, how are you going to guarantee that the insurance companies pass on the savings to the patients? And three, how are you going to deal with pharmacies that just won't stock the drug because they won't get the discount? And a fourth question is, why are you targeting the pharmacist that has no control over what a manufacturer discounts or sells a drug for? Why wasn't your private right of action against the drug manufacturer?
Kate Marshall for the record. Thank you. I appreciate these, especially since you're a pharmacist. Pharmacist. I need to start with a caveat. I am not a patent lawyer. I am an antitrust lawyer. And so let me start by antitrust law, as you know, often intersects with patent law these days, especially when it comes to lots of things that are made in China. All right. With respect to the patent laws, the Inflation Reduction Act dealt with that. In part of your answers, I'm going to have to parse between trying to relitigate the Inflation Reduction Act, which is not what this bill does, but which some of this conversation is about, and then dealing with the bill AB 250. So the Inflation Reduction Act basically said, for the drugs that they choose, those 10 drugs, the patent, the exclusivity will be anywhere from 7 to 13 years. It will not be 17 years, and Congress has the right to decide that. One of the things that happened during the Inflation Reduction Act, for background purposes, is that Congress became aware that many of these manufacturers were taking a drug that they had 17 years on the market, slightly altering it, to put it on a very simple level, cornflakes new and improved, and then extending the patent for another 17 years, okay? So they're going to put a stop to that silliness that continues in exclusivity they should never have had. And with all the negotiations and all the parties there, they came to the point where certain drugs 7 years, certain drug 9 years, certain drugs 13 years, okay? So the patent law has been decided at the federal level, and that is not the concern of AB 250. Talking about the whether or not we can do it, again, the Inflation Reduction Act changes the landscape, because what's happening is Nevada is not doing anything. We are simply adopting by reference federal law for everyone else. We are not passing requirements on anybody except to say that when you, a patient, go to the pharmacy, you will pay no more than. So this gets to your issue of the delta to the patient. The patient will pay no more than the Medicare negotiated price. So the insurance company doesn't have an option. And the Inflation Reduction Act actually dealt with this, because one of the reasons that we have 2 years to work through this is the Inflation Reduction Act says you, the pharmaceutical manufacturer, need to determine how you're going to get that medication on the shelves of the pharmacy at the Medicare negotiated price. Not the insurance company, not the PBM, not the pharmacy. You, the manufacturer, are obligated to get that medication there. Now, when talking about the pharmacist and whether or not they will have that medication, you will certainly have the medication for Medicare patients. I will tell you, as an aside, that currently there are discussions going on in DC where the pharmaceutical manufacturers are saying, well, if this is the case, we're going to sell to CVS and we're not going to sell to an individual pharmacist, okay? For the Medicare negotiated prices. They are making all these kinds of grandiose accusations. And now we come to the fact that I am an antitrust lawyer, okay? When we talk about markets, and a lot of times you're going to see people coming up here and talking about markets, we assume an open and spontaneous competition. We assume that prices are set by supply and demand, with each seller acting non-discriminatory, not saying, for example, I'm only going to sell to CVS, and treating customers alike. That's what we assume when we talk about markets. But here, you have potentially pharma threatening to say, well, we're not going to sell. We're not going to sell to anyone who's under 65. The same medicine at the same price for the same condition. That's a monopolistic action designed to manage prices without competition or market forces. That's monopoly behavior. We here in Nevada are very, very proud of capitalist economies, open markets, competition, choice. But I can tell you as an antitrust lawyer that when the antitrust lawyers law says that you should have the liberty to buy and sell, they don't mean the liberty to maintain price control by holding consumers hostages or holding a pharmacy hostage until they agree to pay monopoly prices. I don't think our legislatures will take kindly to that threat. That's not who we are. It's not our character as Nevadans to play that game. I also think that pharma's lawyers may have yet to engage in reviewing those kinds of threats from a legal point of view as to whether or not they have exposure for engaging in monopolistic behavior where the consequences may be that a person may lose their life. I don't think that they have thought about the risk associated with that actual activity. Thank you.
Just one follow-up is that I know that in the Inflation Reduction Act, when that was being dealt with pharmaceutical drugs, that originally private insurances were included in that legislation, and then they took it out. So again, I still don't understand what the power is of the state of Nevada through a law to force a drug company to sell at a certain price that they have negotiated with Medicare in response to that act. And by the way, we don't even know the details of what that type of negotiation is going to be. We have no idea because it hasn't been done yet. We probably won't know, as my colleague to my right said, for probably a couple of years. But we'll agree to disagree. Listen, I share the same premise that you do. I'd love to find a way to find pharmaceuticals less expensive, especially some of these more expensive ones for people that have to pay for them. I will say this, pharma, even when you see the advertisements on television for many of their drugs, where they do a lot of the drug marketing, they always put a caveat in the commercials that if you can't afford the drug, we may have a special program for you. And I know that many of them, maybe not all, but many of them are philanthropic and really don't want to see people do without medications and provide for some affordability for those that can't afford them. And then the last thing I'm going to say is, we often, unfortunately, demonize drug companies because they charge a lot of money. And you bring up a very good point that in other countries, they have federal price controls where if you don't comply with those price controls, you can't sell that drug in the country. And I'll give you an example. And this is one of the hallmarks of why we have such a great pharmaceutical industry. When people got hepatitis C, they were basically in line to have to get a liver transplant, which is about $1 million, and they'd be on anti-rejection drugs, sentencing them basically to $1 million for the rest of their lives. And then a company came out with a drug called Sovaldi, which is a cure, if you can imagine that, for hepatitis C, not with an IV, but oral therapy for like 6 weeks. And when people saw the cost of it, about $80,000, people almost fell to the floor. My gosh, how can you charge that kind of money? But when you look at the $2 million that would be saved by the patient and possibly saving their lives, then, what's a life worth? And then as we saw more competition in that pharmacological class came out, and then Sovaldi adjusted their price to the competition, like you said. When they have competition, they're going to lower their price, and they'll deal more proactively with PBMs, pharmacy benefit managers. But I worry that if we don't have these investments in these pharmaceutical companies, that we're not going to see a timely delivery of cures for cancer. My mom passed away at 57 years old from breast cancer. If she was alive today, she probably would have survived. I've got a grandchild with severe case of autism. I'm hoping we find some pharmaceuticals for autism. And then we have to take into consideration for how many drugs come on the market and how many don't come on the market after billions of dollars being spent on research and development because they have side effects, maybe they kill people in addition to trying to heal them. So these are a lot of the struggles that I have today in wanting to provide affordability to patients that can't afford it. But at the same time, I want to make sure that research and development continues so that we have cures for serious diseases that we have today. But I appreciate your efforts.
Thank you, Kate Marshall, for the record. So let me try to parse through this. So first off, again, some of this we're really talking about the Inflation Reduction Act. But let me try to parse through it. Your major concern in terms of AB 250 is where does the state get the right? We are not setting price controls. We are saying that the patient will pay no more than the negotiated price. The patient can pay less. We are not telling the manufacturer what to charge. The patient will pay no more than the negotiated price. It's interesting to me that when they set the cap on insulin in the Inflation Reduction Act, that Merck came out quite quickly and started offering insulin at a lower price. But I'll just put that as an aside to you of what happens when you start to try to make a market actually competitive. Let's talk a little bit. This is moving to the, so we have the right to say in Nevada, in any state, that the person shall pay no more than, okay? That's different than saying to the pharmaceutical company. I do want to strongly correct the notion of whether pharmaceutical companies are demons or not demons. As an antitrust lawyer, I can tell you that they are companies. They're bound to maximize their profits. They're bound to try to do the best they can for the products they have, for the constituents they serve, and for their stockholders, okay? That has nothing to do with being demons. And I am here, and many of us are here, because of the medications they provide, but I will get to R&D in a moment. Let's talk a little bit about negotiation. What the Inflation Reduction Act does say is that they took 50 drugs, and we do know some of the parameters of that negotiation. The drugs have to have been on the market for a certain amount of time. We've talked about that. There can be no competition coming up in the next 2 years. If the pharmaceutical manufacturer is able to show that a company is about to enter the market within 2 years, that drug will not be put on the list. The drug must be exclusive, no competition, high spend. Medicare must spend a lot of money on the drug and high cost. Okay? So we know that those things have to happen. They are allowing in those negotiations for a reasonable profit. That's part of the negotiation. The prices will be reduced anywhere from 20 to 60%, depending on what the profit margins have been in the past. So we are not doing that negotiation, but I can assure you that there are negotiations happening and pharma's at the table. All of pharma is at the table. Now, let me get to you then. So we talked about price controls, the right of the transaction, negotiation. Let's talk about R&D. The Congressional Budget Office did an analysis to say, well, if we pass this Inflation Reduction Act, what happens to R&D? I can provide you with information that, let me answer a few misconceptions. One, the misconception that all R&D is done by public universities. Most foundational research is done by public universities, but when you get to the fact that the therapy, actually producing the therapies, that's often done by our private sector. So let's dispel with that myth. Let me get to the question of whether or not the spend rate on R&D. The pharmaceutical companies spend 2 to 3 more times on marketing than they do on R&D. But let's get to R&D itself. The Congressional Budget Office said that over the course of a decade, there would be 2 fewer therapies as a result of these actions. That CBO analysis was put out when the bill still said "and commercial insurers." So there's your answer. Thank you.
If I can just hop in here. Thank you, Senator Stone, for your questions. So I was talking to folks in Las Vegas over the weekend, and this bill came up, and and to your point, to your question about what is a life worth. First, I don't know if you're talking about people who are working class and struggling to pay their bills, or what is a life worth when you have fantastic insurance and you could potentially even afford an $80,000 health bill. I don't know. But the folks that I was talking about, she's a nurse. Her doctor gave her a prescription. She went to a chain pharmacy, I'll say it that way, for her daughter. So it was her daughter. She was telling me the story about her daughter. She went to the chain pharmacy, and they told her that the cost, even though it was insured for this prescription, was $200. There had been an accident where she burned some lashes off. And she was knowledgeable enough to say, no, forget it, cancel that prescription. I'm going to go to a different pharmacy. And the pharmacy said, well, but your insurance isn't going to cover it at a different pharmacy. And she said, well, I will give it a try. She went to another pharmacy based out of a supermarket, who she put it in, insurance didn't cover it. She got a phone call 2 hours later from the pharmacy saying, I'm really sorry that, we can't cover it. However, we found a manufacturer's coupon, and now your cost for this drug will be $24. So that is just an example to go back to other options. For your example, the marketing, the commercial, where in a commercial promoting a prescription drug, it does say, if you can't afford your prescriptions, call X. But you can't just call and say, I need this drug. You have to go to a doctor. A doctor has to prescribe it. Then you have to see the commercial at that time. And remember all of that. So for most people, including my friend who told me this story, that commercial, that program, which is incredible when people know about it, but unless you know about it, it's illusory. It's not like they're, papering cars or things like that. You have to be in the right place at the right time to even know that's available. And then you have to contact them and go through that whole process. Or, strangely enough, just go to a different pharmacy in this particular case and get the drug for way less than half of what the cost was, even though your insurance was at another place. And the only reason that I wanted to bring this up is to again highlight that our healthcare system, although one of the best in the world, has flaws in it. And the opportunity to provide relief directly to people where they don't need to watch the commercial, they don't need to go from one pharmacy to another to get a price that they could afford that is not going to cost them their rent payment, their car payment, their house. This is all done. This is directly skipping over everything and saying if your doctor thinks that you need this prescription drug for your life-altering health situation, this is the maximum you're going to pay wherever you go in the state of Nevada. Thank you.
Additional questions? Senator Buck?
Thank you, Chair Spearman. So can you just clarify for me the private right of action?
Good morning. Hi, Senator Buck. Thank you for the question. So basically, in our laws today, we have consumer protection laws today, and it says that if someone commits a fraud or violates those consumer protection laws, then an attorney can bring a lawsuit on behalf of that person. The person can go and represent themselves. The AG can bring a lawsuit. And this basically incorporates that, what we have today, and says that this will be included if the patient cannot purchase the prescription at the Medicare negotiated price, then there is a right of action. If the pharmacy can't purchase the prescription at the Medicare negotiated price, if the insurance plan can't purchase the prescription at the Medicare negotiated price. Remember I said that under the Inflation Reduction Act, it's the requirement of the manufacturer to move that product down to the availability of the patient. Then there's a right of action, and that is $2,000 per transaction. So let's say that you needed a particular medication once a month, then each time you went to get it, that's a violation. Let's say the pharmacist wanted to order 50 units, right? Each transaction would be a private right of action. Am I answering the question?
Yeah, so if I'm a hospital or a small pharmacist or even a large retail chain, then am I subject to private right of action should this bill pass?
Kate Marshall, Senator Buck, thank you. If you are doing what Senator Stone suggested might happen, which is keeping the delta for yourself, yes.
So if this bill passes, then you focused a lot on manufacturers, so can they get sued then also?
Yes.
Okay, so it's like a whole continuum. And then is there a requirement that the insurance company must pass on the savings?
There's no
Also?
requirement that you sell at a certain price. There is the requirement that the person only pay the negotiated price. However, if you are going to require the person to pay more than the negotiated price, then you're in violation of the consumer protection laws.
Because the way I'm thinking is that the manufacturer, if they sell it for a lot, then you're going to stop anybody from covering it. On another line, what is the exact timeline for the feds to identify the specific drugs?
So, Kate Marshall for the record. So right now, there is a list of 50 drugs. and they are currently determining which will be the first 10 out of that list. The first 10 will be identified by September of this year. And then just I want to make sure that each year, more drugs are added, right? Yeah. Thank you very much.
Additional questions? So thank you. Lieutenant Governor, so it seems like there's a hang-up about what negotiated price looks like. Can you take me from A to double Z, or whatever that looks like? What's the first step, and how do we wind up at, I understand negotiations, back and forth, I understand that, but what is the process of negotiating for the correct price?
Yeah, so thank you, Kate Marshall, for the record. And I know we're taking a lot of your time early in the morning. I hope everyone had coffee. So in September, the first 10 drugs will be identified. In September of next year, the price for each of those drugs will be published. So all of us will know what the negotiated price is. It will be public. Everyone will know what that negotiated price is. That will be September of 2024. And then in September of 2025, they can begin to start to roll out, so that in January of 2026, they will roll out those drugs at those prices. So what is likely to happen, and this gets into some of our more detailed discussion, what is likely to happen is those drugs are currently not covered, many of them not covered by insurance, and so not in the formulary with the insurance companies that they negotiate with the PBMs and the pharmaceutical manufacturers. What happens is when you start to lower the cost of that particular prescription, the pharmaceutical manufacturers will have to increase volume, which means that now they would like you to prescribe it earlier in the treatment. So now you begin that negotiation process with the insurance companies, with the PBMs, to pull it down. How often, how much, what are we talking about here? And you heard Senator Daley say, we often talk about it's going to be Medicare Plus. So you're going to see those negotiations. Well, we're not going to see those negotiations, but they will happen, and then you will get your prices at the individual level. But for those 10 drugs in Nevada, you can be 65 or you can be 45. If you have asthma and that's a drug that's covered, you're going to pay the negotiated Medicare price.
Thank you. Any additional presenters? Okay, well, it's not too early. Thanks for taking us to school. Appreciate it. You want to step back, and we'll open public testimony now for those in support of Assembly Bill 250. Please come to the table. Anyone here in Carson City? See some folks moving in Las Vegas. So there are 3 chairs down south and 3 chairs up here. We'll begin in Carson City.
Good morning, Chair and members of the committee. For the record, my name is Annette Magnus, and I'm the Executive Director of Battleborn Progress. We're in strong support of AB 250, and we thank Assemblywoman Considine for it. Prescription drugs are often necessary for treating and managing various medical conditions, and in many cases, they can be life-saving. However, the high cost of prescription drugs can create significant financial barriers for many people, preventing them from accessing the care they need. With the Affordable Medicine Act, Nevadans will pay the negotiated price and will benefit from the regulations on how companies change and control pricing. You've heard and will continue to hear this session that Nevadans are suffering and need economic relief. This is much needed relief. By bringing stability to drug pricing, we can help those people who are suffering from high drug costs. No one should have to choose between their medication and living. We have to do better in this state, especially on this type of issue, and this bill is that opportunity. I'll just say, as somebody with asthma, this bill is critical. We urge your support of AB 250. Thank you.
Good morning, Madam Chair. Chris Daly, Nevada State Education Association, the voice of Nevada educators for over 120 years. NSCA is also in support of AB 250 to address the skyrocketing costs of prescription drugs, and thanks Assemblymember Considine and Lieutenant Governor Marshall for their work on this issue. This session, NSCA has spent a good deal of time talking about the stagnant and relatively low pay of educators, with the teacher wage gap at 80 cents on the dollar, workers who make our schools run earning as little as $11 an hour. But the other side of this coin is household costs, which have skyrocketed in recent years. And for many educators, and especially our retired educators, their biggest pocketbook issue has been healthcare costs, driven in part by the increasing cost of prescription medications. AB 250 will help rein in these costs, providing relief to thousands of Nevada educators and retirees. It's smart public policy, which is fair and critical to the health and well-being of everyday Nevadans. We ask for your support. Thank you.
Good morning, Chair and members of the committee. For the record, Tess Opferman here on behalf of the Nevada Women's Lobby. One of the 4 main priorities of the Nevada Women's Lobby is access to health care. A core piece of this is looking at prescription drug prices and working to ensure prescription drug prices are affordable for all Nevadans. We are especially supportive because one of the drugs being looked at is treatment of HER2 breast cancer, something that affects women of all ages, not just those 65 and older. We feel that all women should be able to access this life-saving and critical medication. Asthma, diabetes, blood clot medication are all being looked at, and we know that these affect populations of all ages, not just those 65 and older. Lieutenant Governor Marshall talked about the choices families are faced when dealing with health conditions and incredibly high medication costs. Families are choosing between critical drugs, food on the table, and a roof over their head. We are in full support of AB 250 and all measures that help limit the high cost of prescription drugs. The Inflation Reduction Act took a huge step by passing legislation that would create a maximum price index for certain drugs, but Nevada needs to take the next step by ensuring all ages can benefit from these maximum prices. Please pass AB 250. Thank you.
Kent Irvin, KNT-ERVIN for the Nevada Faculty Alliance. We support AB 250. We've been following the Public Employees Benefits Program for many years, and drug costs have been a major driver of costs for participants and for the state over the years, and the increasing cost of healthcare generally. And it particularly impacts our members and state employees who have a chronic condition, who need one of these drugs to stay productive in the workplace. Over the years, we've been very frustrated by the lack of transparency and in the pricing models of the drugs, of and all the intermediaries and the various ways companies use rebates and so forth to try to influence the marketplace in drugs. And so this kind of bill to help that process and control costs is very important. Thank you.
Okay, let's go down to Las Vegas. And if there's anyone else here in Carson City testifying in support, please come to the table. Las Vegas.
Chair Spearman and members of the committee, for the record, my name is Maria Moore, and I'm the State Director of ARP Nevada. Today I speak on behalf of ARP Nevada's 347,000 plus members, and I thank you for the opportunity to speak in support of Assembly Bill 250 today. ARP Nevada believes that we must engage individuals and communities to support healthy living, and further that healthy living and communities are critical to ensuring the health and well-being of Americans. Individuals, government, and the private sector should work together to promote improvements in health. A principle of this is that as a society, we must ensure adequacy and affordability. Costs such as premiums, deductibles, and other out-of-pocket expenses should not be burdensome to consumers or limit access to coverage or necessary services. Sufficient financial assistance should be available to consumers with low incomes to ensure affordability for all. We believe AB 250 is a step in the right direction, and therefore thank Assemblywoman Considine for bringing forth this legislation. Thank you.
Good morning, Chair and members of the committee. My name is Ariel Guevara. I am a regional organizing director with For Our Future Nevada, but today I am submitting testimony on behalf of a private citizen and registered nurse, Elizabeth Yanez. The testimony reads, my name is Elizabeth Yanez. I am currently a registered nurse who previously worked in case management for an active healthcare company. During my time as a case manager, I cared for the needs of numerous patients in Southern Nevada. So many of my patients, even when covered through Medicare, would still have lapses in coverage that would require them to choose between paying for expensive treatment or resigning themselves to a poor physical quality of life. Unfortunately, as many of my patients were disabled due to their conditions, this meant they were also living on fixed incomes and unable to re-enter the workforce to make ends meet. Enacting a bill like AB 250 would drastically improve the lives of so many of my former patients that simply weren't able to afford the unspeakably expensive prescriptions that Medicare plans or social services were unable to provide. These medications are necessary to save their lives. I had patients taking out personal loans just to be able to afford their life-saving medications. I felt powerless in a system that is meant to cherish life, not diminish it. This is wrong, and the state of Nevada should do everything in its power to make these important medications accessible to those in the most dire need of them. I urge this committee to pass AB 250, and in doing so, protect the needs of Nevada's most vulnerable communities. Thank you for your time.
Thank you. Anyone else in Las Vegas? Don't see anyone moving to the table here. So BPS, let's go to the phones.
If you would like to testify in support of AB 250, please press star 9 now to take your place in the queue.
BPS, do we have anyone?
One moment, Chair.
Hello, do you hear me?
We can hear you.
CYRUSHOJJATY. Thank you for having me on. Good morning to everybody. We'd like to thank the sponsors of this bill. First of all, I'd like to point out when it comes to an industry like prescription drugs, the market left in its own devices is not efficient in determining the best prices for consumers. People's lives are at stake. I'm very surprised that there were many people who voted no on this bill on the assembly side. It just doesn't make sense to me. And I'm very glad that we are fighting against big pharma greed, although I wish more was done during the events of the last 3 years. More importantly, I'd like to point out that this will really help our economy. When people are paying an arm and leg for these prescription drugs, just imagine how much economic activity is lost. So with all the savings we have, people can pay for their housing, they can pay for a lot of other expenses, they can go out and really have a good jumpstart to the economy and so forth. Although I think more efforts can be done in other issues as well with high prices, depending on the bill. But other than that, thank you so much, and hopefully this bill would pass. And even if there's things that are not that good, I mean, something has to be done. We have to raise an alarm. Just because a bill is not perfect, a lot of bills can do a lot of good than harm. Thank you so much, and I will yield my time.
Thank you, Chair Spearman and committee members for the opportunity to testify today in support. My name is Eric Chang, ERICJENG, and I'm the acting executive director with One API Nevada. Nevada is home to over 392,000 Asian Pacific Islander Americans, of around 12.5% of our total population. As the fastest growing community in Nevada, we are aware how our advocacy needs to be rooted from real Nevadan families by both data research and also canvassing and talking to our community members. From door to door, knocking on folks' door, healthcare has always been on the top issue, especially on affordable drug pricing. Among disaggregated healthcare cost data, nationally, Filipino Americans have the highest spending on prescription drugs of any Asian ethnic subgroups. Filipino Americans do make up 45% of all our AA and HPI community here in our state. We also have disaggregated data on certain ethnicity with higher risk of diabetes. AB 250 would help to ensure that all residents have access to affordable prescription drugs, reduce healthcare costs overall, and stimulate the state's economy. It's time for Nevada to take action to address the high cost of prescription drugs and leverage federal action and negotiation ability to ensure that all state residents can enjoy the savings. Thank you, and we urge for your support for AB 250.
Good morning, Chair and members of the committee. My name is Brianna Escamilla, and I'm calling in on behalf of Planned Parenthood Votes Nevada in support of AB 250 because we believe that all Nevadans, regardless of income level, deserve access to the medication that they need to live healthy lives, and that cost should never be a prohibitive factor in receiving life-saving and medically necessary care. We urge your support. Thank you.
Good morning, Madam Chair and members of the committee. My name is Steve Warner, I am a proud resident of AD 8 and Senate District 11. I am a proud retired special education teacher and the president of the Nevada.
So are you still there?
Hello?
Hello? Yes, can you begin
Can you
again? Yeah, we lost you after proud.
Okay. I'm a proud teacher, retired special education teacher, and the president of Nevada State Education Association, retired. I promise to be brief. Thank you to all of the sponsors of this bill. I have COPD and a heart condition. My wife has asthma and is currently being treated for cancer. Last year, we spent well over $8,000 for life-saving drugs. Much of that was put on credit cards, which are rapidly becoming overwhelming. Luckily, help is on the way for us because of the Inflation Reduction Act, allowing Medicare to be able to negotiate prices for prescriptions. However, many people we know won't be Medicare eligible for several years. All Nevadans should be covered by the benefits of those negotiated prices. Why should Big Pharma be allowed to make billions on the backs of those that can least afford the cost of the drugs, while they continue to receive our money for research and development through government grants? Why did we have to watch commercials for drugs? Let my doctors decide what's best for me, not accountants and advertisers. This is the time to help all Nevadans. Please support AB 250. Thank you very much.
Good morning, Madam Chair and members of the committee. My name is Marlene Lothard, representing SEIU 1107. High drug costs can be a major burden for our members, especially those with chronic conditions who rely on medication to manage their health. Without affordable drugs, people may be forced to forego necessary treatment or cut back on their medication, which can lead to serious health complications. This bill is very important so all can benefit from the negotiated rates that Medicare will make with drug companies. We support AB 250 and hope you will too. Thank you very much.
Good morning, Chair Spearman and members of the committee. My name is Matthew Wilkie, Matthew Wilkie for the record. And I'm a 13-year pharmacy professional. I have not quite reached the prestige as Senator Stone, but I'm here to express my support of Assembly Bill 250. As a healthcare provider, I see firsthand the struggles that my patients go through when they can't afford their prescription medications. They're forced to make impossible decisions like picking and choosing between filling that prescription and buying the groceries in their carts. This is why these drug caps and the fair market prices are so important, especially for the people of Nevada. We know that the cost of healthcare is rising everywhere, but it is particularly acute in our state. Many of our residents are on fixed or low incomes and simply cannot afford the cost of rising prescription medications. By setting these caps and the fair market price, these patients have to pay for their prescriptions. We ensure that people have the ability to pay for these medications and that they can stay healthy. It will prevent unnecessary hospitalizations due to having to skip medications, as Assemblywoman Considine mentioned, in dosage, reduce healthcare costs to our state, and ultimately improve the quality of lives of all the residents of Nevada. I urge you to support AB 250. Our residents deserve access to affordable health care, and this is one small step that we can take to make this happen. Thank you so much for your time, and you all have a great day.
The public line is open and working. There are no callers at this time.
Thank you. So now we'll move to those in opposition here in Carson City. If you're in opposition down south, please come to the table. 3 chairs here and 3 chairs down south. Okay. So begin when you're ready.
Morning, Madam Chair. For the record, Danny Thompson. I'm here today representing PILMA, which is the Pharmaceutical Industry Labor and Management Association. It's a trade organization group that is comprised of international unions and pharmaceutical industry. Our chairman this year is the international president of Sheet Metal Workers Union. We have the International Brotherhood of Electrical Workers, the operating engineers, the iron workers, to name a few. We are against this bill. We're concerned that, well, to begin with, we don't even know what the list of drugs are that are truly going to be chosen based on the criteria that the federal government has. We think that passing this bill now is literally putting the cart before the horse. The legislature here meets once every 2 years. There'll be another session before all of this happens. I think it's prudent to wait and see what the ramifications are of these changes, because this is a very complicated issue, I think, as you all have heard. If you get it wrong, who knows? I don't know what's going to happen, but I do know that it doesn't make sense to pass this prior to all these things happening and determining which list of drugs are on the list and what the ramifications of those changes are. So we would urge you to wait until the next legislative session to consider an act like this. I don't know of any other state in the nation that's considering a bill like this. We think it's prudent to wait. We're in opposition to this bill. Thank you.
Thank you, Chair. Good morning, Chair and members. Daria McGrew, for the record, DHARIAMCGREW, Director of State Policy for Pharma. I'm here today in respectful opposition to AB 250 for many reasons. In the interest of time, I promise to be brief. Is the healthcare system completely off kilter? Yes, we are in agreement there. But I'm sorry, this bill is oversimplified and is not the solution that you think it is. First, the bill misunderstands the pharmaceutical supply chain. It does not give Medicare copays to everyone else. The MFP that will be determined by the federal government for Medicare is a price for a government payer or a health plan. It's not the price that patients pay. So it still may be well over what is affordable for the average citizen. It contains no mandate, as was discussed, no mandate for plans to lower your copay. Nothing requires them to make the savings they're going to get and lower premiums. We all have a part to play in this, but this proposal lets insurance plans and middlemen completely off the hook for their role in the cost of medicine. Solutions that truly help constituents really must look across the supply chain and bring all supply chain entities to the table or to task if that's what you wish. Additionally, this is premature and hastily drafted without complete information. It skips past transparency and data and analysis of cost drivers in this state. The federal law does not go into effect until 2026, as was mentioned, because they need all that time, possibly more, to figure out how to implement it. The process just got underway, and there are complex operational and legal issues to be sorted out. And that is for Medicare only. This bill does not simply codify that for the rest of the state. It broadly expands the federal concept in ways that are completely uncharted. The commercial market is very different from the government-funded Medicare market. There are no mechanisms in this bill for regulating and making any state-level decisions. There is no need for a state to try to fly a plane while the feds are still building it. This concept needs more work, and we ask you not to pass this bill this year. Thank you.
Good morning, Chair Spearman, members of the committee. For the record, my name is Jimmy Lau, first name Jimmy, last name Lau, with Ferrari Reader Public Affairs representing the Biotechnology Innovation Organization, a trade organization with more than 1,000 biotechnology members across the United States in opposition to AB 250. AB 250 does not contemplate the realities of the prescription drug supply chain and could negatively impact access to prescription medications. Pharmacies, hospitals, and doctors in Nevada that provide medicines to patients must first purchase those medicines, often through national distributors or cross-state purchasing groups. These purchases are not controlled by AB 250, and the providers will likely have to acquire these medicines at a cost higher than the AB 250 max fair price. This places providers in an untenable situation of losing money to provide the medicines that patients need or not stocking certain medicines. Additionally, this bill misapplies the IRA's maximum fair price as a cap on consumer spending. The MFP is intended to be the price that a Medicare Part D plan pays for a drug, not what the Medicare recipient must pay at the pharmacy counter. Proponents discuss the point-of-sale transaction where the MFP would apply, but the pharmacy does not bill the patient for the cost of the drug. They bill the patient's health plan, who determines what the patient pays. The provisions of the IRA that are intended to benefit patients and lower their out-of-pocket drug costs are found in the law's caps on out-of-pocket spending, which are different from the MFP and are not included in AB 250. Finally, we oppose price controls because they result in loss of investment for future innovations, meaning fewer new medicines will be approved. Numerous estimates for the IRA forecast a reduction in investment towards new therapies, but more importantly, the Congressional Budget Office forecasts a reduction in the number of drugs that would be introduced into the U.S. market, meaning less opportunity to improve the lives of Nevadans. We appreciate Assemblywoman Considine's intent of lowering prescription drug costs, but we do not believe this policy, which impacts providers and patient access, is the right way to accomplish this shared goal. And we ask the committee to oppose, and I'm happy to answer any questions. Thank you.
Good morning, Chair Spearman and members of the committee. Amy Sjogren with Black & Wadhams, a little froggy this morning, representing the Nevada Hospital Association, who was in opposition to this bill. As it has been addressed, there are many unknowns at the federal level. This bill would restrict the pricing of pharmaceuticals sold here in Nevada and may actually decrease access to patients and the transparency in the process. So we ask you to oppose the bill. Thank you.
Good morning. For the record, my name is Adam Porath, P-O-R-A-T-H, and I'm representing the Nevada Society of Health System Pharmacists. Our organization is opposed to this bill. Particularly, we have concerns for hospital and health system providers that are our safety net hospitals, our disproportionate share hospitals, critical access hospitals that utilize the 340B program. That program and the funding that those facilities receive is completely funded on the delta for commercially insured patients. And so if you remove that, you're removing the funds that are supporting the indigent care for those critical access hospitals and disproportionate share hospitals. Thank you.
Good morning, Madam Chair, members of the committee. Liz McMiniman, Retail Association in Nevada.
representing many of the community pharmacies in the state of Nevada and who are very concerned. We've also submitted a letter, but there's a couple of pieces, after listening to some of the testimony this morning, there's a couple of pieces I wanted to put on the record. With very little exceptions, a provider such as a pharmacy, a hospital, a clinic that dispenses or administers drugs to patients must first purchase the physical product and then receive reimbursement to cover the cost of the product. The complex system in which prescription drugs are purchased and then distributed from a manufacturer to a wholesaler, then to a healthcare provider, and finally to the patient involves numerous transactions between each entity and with insurance companies, pharmacy benefit managers, and government payers. At each step along the way, these transactions are subject to private negotiations and often involve complicated discounts and rebate arrangements. AB 250 puts our state providers and other healthcare entities at risk. Even if Nevada establishes a cap on the price for prescription drugs based on the MFP, the price at which these drugs are bought and sold nationally will remain unchanged to the pharmacy, to the end provider, to the patient. And because many Nevada providers purchase drugs in out-of-state transactions that would not be subject to the limitations of AB 250, our in-state distributors and providers will purchase drugs at a national price and then be subject to the in-state cap. Providers will then have to choose whether to purchase drugs for more than they can be reimbursed or stop purchasing some drugs altogether. This, in turn, could drive the patients to out-of-state retail and mail-order pharmacies, further deepening the impact on our healthcare environment here in Nevada. AB 250 also puts patient access at risk. This is the biggest part for me that's so concerning. Healthcare providers often lose money on claims for prescription drugs. However, if pharmacies, clinics, and hospitals lose money every time they dispense or administer certain prescription drugs, they may find it infeasible to stock certain drugs. But my biggest concern is for those patients in Nevada, because if those drugs aren't available here, where will they get them? We urge you to look at this. As Mr. Thompson said, we ask you to consider this and looking forward, and maybe next session we have a discussion. And as every one of you have heard, my biggest thing and my biggest flag that I raise is let's look at those prescription benefit manipulators, managers that have the real impact on the cost of drugs to our patients in Nevada. I think if we discuss that, then we will have a discussion that will impact the patient, not the providers of these drugs. Thank you very much.
Chairman Tom McCoy, Nevada Chronic Care Collaborative. Nevada Chronic Care Collaborative was joined by 11 other patient, provider, and prescriber organizations in a group letter that you have been supplied. Most Nevadans would be okay with a try it before you buy it program, but not a buy it before you could even try it program. But that's what AB 250 wants the state to do. A statutory tie to a federal program that has not been fully implemented pertaining to drugs that have not been identified for fixed prices that have not been negotiated. AB 250 is just too premature and should be opposed in this session. Thank you.
Good morning, Chair, members of the committee. Paul Murray, acting with the Vegas Chamber. First, I'd like to thank the bill sponsor for meeting with the Chamber and regarding our concerns with the bill. We, of course, appreciate the perspective shared by the proponents of the bill and what they're trying to achieve. But as you know, the Chamber has over 70 sectors within our membership, including healthcare and several subsets within the healthcare industry. And as this dialogue has evolved throughout the session, our members have reached out to the Chamber about concerns they have about the bill and negotiate pricing. As you have heard, this bill could potentially impact drug deliveries and shortages to our state, lower research and development spending, which will impact next generation of prescription drugs, fewer prescription drugs reaching the market, and longer wait times to access those prescription drugs, and of course the concern about getting ahead of the federal government. And as you all know, the Chamber always has concerns about any potential prior right of action. Again, we do appreciate the bill sponsor for meeting with us and understanding our concerns. Thank you very much.
So let's go down to Las Vegas.
Thank you, Chair Spearman and members of the committee. My name is Emily Osterberg, Osterberg, on behalf of the Henderson Chamber of Commerce and our over 1,800 members, most of which are small businesses, and we are here opposing AB 250. Regulating pharmaceutical companies to base pricing on Medicare costs would potentially stifle innovation, negatively affecting the business community in Nevada. In addition, this bill has wide-ranging impacts for our healthcare members, including hospitals and pharmacists, who would be subject to a private right of action in the event that they violate a provision of the law. These measures only add to the cost of operations of these types of businesses, which are ultimately passed on to the consumers and patients that this bill is meant to assist. For these reasons and the previous reasons mentioned, the Henderson Chamber is opposed to AB 250. Thank you.
Let's go to the phone lines. BPS, anyone on the phones?
If you would like to testify in opposition to AB 250, please press star 9 now to take your place in the queue. Caller 646, you're unmuted.
Yes, this is Kaylyn Bowman, KAYLYNN and I am the current president of the Nevada Pharmacy Alliance, and we are currently in opposition to the bill as it is currently written. I understand Nevada that patients need access to affordable medication. However, you are probably aware that pharmacies do not set drug prices or control what they are reimbursed when the medication is billed through insurance. Even drug manufacturers and pharmacy benefit managers control this part of the drug supply chain. Recently, the situation occurred where pharmacies are purchasing items and they're not being reimbursed with the dispensing fees included at rates lower than what they can obtain the medication. Obviously, losing money on transactions is not a sustainable business model, so pharmacists have to refuse to fill medication for the patient. This leads to frustration for both the patient and the pharmacist, and does not allow for our small business independent pharmacies to compete with even the larger pharmacy chains. This bill requires manufacturers to not charge a price than the maximum fair price that is calculated. Our concern is this does not have rules for what a wholesaler can sell medications to a pharmacy for, and what a PBM does when it comes to reimburse a pharmacy for their services. In the past, pharmacy has been the one harmed in this type of situation because they do not have a say in the process. This has led to pharmacy closures and less staffing in pharmacies that are still in existence. Another part of the bill that is concerning is that any person aggrieved by a violation of this rule may bring an action for consumer fraud against that entity. Again, the pharmacist and pharmacy do not control the price that the manufacturer sets. The price that the wholesaler sells the medication to the pharmacy for at a rate that the PBM reimburses that pharmacy at. The only thing that the pharmacist and pharmacy can control if it makes sense to dispense the medication to the patient based on circumstances surrounding it. It is an unfair dilemma for pharmacists who want to help their patients and community by ensuring access to medication, and to have considered in doing so, this may hurt the business. We feel that there must be amendments to this bill to move forward, including wording for pharmacy that would make reasonable rate for dispensing a product, and wording that prohibits pharmacists and pharmacies from being named in anything to do with consumer fraud in regard to the pricing. Thank you very much. I appreciate it.
Wiz Rizard, WIZ to ZARD, Deputy State Director with Americans for Prosperity. We strongly oppose Assembly Bill 250, which is Pharmaceutical Drug Price Control Bill. What this bill basically does is what everyone said, and it's making it a crime under Nevada consumer fraud law to sell a prescription drug in Nevada at a price above Medicare's maximum fair price. This leads to harming actually the patient's Medicare or the bill sponsors present to actually resolve their problems. And these price control often leads to significant shortages, and as many have said, stifle innovation. When we talk about monopoly, this is not a monopoly in the sense of what the bill presenter said, but what is a monopoly is the regulations that both state and federal government has implemented to ensure that these pharmaceutical companies or manufacturers are actually protected from actually having free and fair competition entering the market to provide quality pricing. When it comes to access and options, what this bill would do if you vote yes is actually restrict that, and it's going to proliferate medical tourism, where Nevadans are going to have to go to other states or other countries to access some of the drugs that basically this law would restrict these manufacturing pharmaceuticals from providing. Using taxpayers' dollars and the lethal force of the law is not a capitalist society, but a more of a communist socialist society that results in a degradation of life, liberty, and everyone's pursuit of happiness. The bill presented talked about this is not a price control bill. It is actually misleading because it actually is. Whenever you use the law and taxpayer funds and tell a business that this is what they must do, and then look to use the law to go after them, that is very much so price control. This leads again to loss of investment. I urge every member to vote no. If we want to have the best health care in the world, the best health care in the entire country, then we urge you to deregulate this and allow more competition to ensure that the prices not only diminish, but the quality and more access and alternatives are provided to Nevadans. Thank you.
Good morning, Chair and members of the committee. This is Leah Lindahl with the Healthcare Distribution Alliance, and we are here in respectful opposition to AB 250. HDA members serve as the critical logistics providers in the nation's pharmaceutical supply chain. We're the wholesale members of the industry and connect over 1,500 manufacturers to roughly 300,000 points of care across the United States, including 400 in Nevada. In their role as a wholesaler, HCA members do not manufacture, market, prescribe, or dispense medicine, nor do they set the list price of prescription drugs or set third-party payer reimbursement or coverage rates for patients in the state. And furthermore, we do not have insight into the pricing of dispensable units or the price that a consumer pays when they get to the pharmacy counter. Wholesalers also operate under a fee-for-service contract with the nation's manufacturers. These contracts are not state-specific. They're done on a national scope. And we believe that applying a federal pricing policy to state-level purchasers would conflict with how the supply chain currently operates. Establishing a cap on the purchase price and reimbursement of a product would leave little ability for a pharmacy, clinic, or other point of care to recoup their costs for administering and dispensing products, and just cause a lot of havoc in the industry. This is also based on the Inflation Reduction Act, which has not been implemented at the federal level, and taking a federal stance into a state could cause undue burden on the state's patients. And we just appreciate a no vote on this legislation and are happy to answer any questions. Thank you.
Thank you. Can you spell your name, please?
Unfortunately, Chair, she's no longer there.
Okay.
The public line is open and working. There are no callers at this time.
Thank you. So we'll move now to those testifying in neutral. Anyone here testifying neutral? Anyone in Las Vegas neutral? No one's moving to the tables. VPS, anyone on the phones?
If you would like to testify in neutral for AB 250, please press star 9 now to take your place in the queue.
Hello, can you hear me?
We can hear you. Go ahead.
Hi there. My name is Jarrett Clark, and I'm the Communications Director for Our Future Nevada. And today I am testifying in support. I was trying to testify in support earlier via the phone, but I was never called on, so I'm hoping I can do that now. Anyway, I am the Communications Director for Our Future Nevada. and I am testifying here today on my own behalf. And I strongly urge this committee to approve Assembly Bill 250. Simply put, this legislation will benefit countless Nevadans who rely on insulin and other medications for their well-being. And 13 years ago, I was diagnosed with a rare genetic blood disorder that puts me at high risk of developing life-threatening blood clots. And managing this condition requires regular doctor visits and a name-brand prescription drug, Xarelto, which has steadily increased in price because there is no generic version of it available. The out-of-pocket cost of this medication is upwards of $700 per month for people without insurance, which is absurd since it literally saves lives by preventing strokes, embolisms, and heart attacks. Fortunately, I've been able to maintain private health insurance to shoulder most of that cost, but there are many Nevadans out there who are not so lucky. And as the bill sponsors referenced, under the Inflation Reduction Act, Medicare is now empowered to negotiate drug prices for seniors, and it's expected that the price of this medication that I take will soon be negotiated to make it affordable. AB 250 will extend the negotiated prices of specific prescription drugs to all Nevadans who need them. And in my work, I regularly speak with Nevadans of all ages who struggle with chronic health conditions, whether it's diabetes, respiratory illnesses, or blood disorders like mine, who have to choose between their life-saving medications and their rent or other bills. And people have died trying to ration their medications because of exorbitant costs. And this bill is a strong step toward reining in out-of-control drug prices. Lives will be saved because of it. So I urge you to pass AB 250. Thank you.
There are no callers choosing to testify at this time.
Thank you. Someone Considine, you all have any closing comments?
Thank you, Chair Spearman and members of the committee. I want to just repeat something I started about an hour and 40 minutes ago. The things that you heard in the opposition are exactly what I have heard. It's the end of private research and development. It's cost shifting. It's not us, it's them. It's the pharmacy benefit managers. It's the insurance company. It's the supply chain. The system needs to be fixed first. We can't do it now, but we can do it 2 years from now when many of us might not even be here. There's too much going on. We'll lose profits. All of those reasonings. One of the reasons why AB 250 is the most elegant solution is because these arguments are things that happen to what I referred to in the assembly when Godzilla and King Kong are fighting each other. Pharmacy benefits, managers, insurance, pharmacy, whatever you want to say, they're fighting each other. And we, the people, are running down the streets just trying to live our lives and trying to get pummeled by these two monsters. And that's sort of, I think, where we are when we go over these. But this bill cuts through all of that. We have the largest negotiators, the strongest entities negotiating at the federal government level for 10 drugs to come up with a agreed upon negotiated price. This is what AB 250 does. It is not a complicated issue because this current situation simplifies it. One of the things that was mentioned today was, let's do it later. Let's wait for the feds, who are already in the process of doing this. We have to get set up for the federal results for this anyway by 2026. There are other states that are doing this. There are Maine and Colorado and Connecticut. There are other states right now that have bills that are doing this. We are not the only state that's doing this. Right now, I think we're the first, and I think we are the most direct doing it, but there are other states. To the point that was raised earlier, sorry, I'm just trying to get all my notes together on this is, as was mentioned by someone who testified in opposition, I agree with Ms. McMiniman. I look forward to hopefully in the future working on the pharmacy benefit managers and working on things to do long-term sustainable healthcare fixes. But what we have right now is a solution that cuts through all of it, that is negotiated and argued at the federal level, that we provide relief for people in this state. And I just want to thank you for that, and then I will let Kate Marshall take over. Thank you.
Thank you, Kate Marshall, for the record. I just wanted to make sure that I clarified. I think I had said these, but there was some discussion about R&D and the opportunity for research and development. What I testified to was pharmaceutical manufacturers spend 2 to 3 times more on marketing than they do on R&D. There was a mention of the Congressional Budget Office report. As I explained to you, that report said that there would be 2 less drugs over the course of 10 years. That was 0.001, if I'm correct. But don't quote me on that because I should probably get you the CBO report to make sure that I got the percentages correct. The Inflation Reduction Act does contemplate and take into account the fact that pharmaceutical manufacturers need to recoup their costs. That is why a drug has to be on the market for at least 7 years and up to 13 years, depending on the type of the drug. The last thing I will say is that I know that you heard from some entities that represent pharmacies. You will see in Section 1, Subsection 2, that there is a exclusion for the pharmacy's dispensing fee. They are allowed to recoup their dispensing costs. That is written into the bill. So it is the Medicare negotiated price plus the dispensing fee, and they get to set that fee. That is not set in the bill. We know that different pharmacies have different costs depending on their volume and how large they are in their dispensing fee. The last thing I would say to you is you heard a lot of wait and see. Don't wait and see when we're talking about patients' lives. Thank you.
If we have the situation that we have now, Madam Chair, thank you, where the federal government is negotiating, you have the largest entities negotiating. If we, as one small state, trying to help the people in our state, cannot pass something that is being negotiated by the strongest and biggest entities in our country, what can we do to provide additional health care help for the people in Nevada? Thank you.
Thank you. I think we have a question from Senator Hammond.
Thank you, Madam Chair. I really just sat back and listened to the testimony, both for and against, and I have to say that when the chair said that, thank you for taking us to school, I felt the same way. You kind of went back and you said, hey, this is what the Inflation Reduction Act did. This is the open markets. You're talking about markets. You're talking about choice. Matter of fact, I may have to use your speech when we talk about school choice, because I think Nevadans do like choice, and I think it actually encroaches into that area as well when we talk about choice and how we want to have that. The only question I have for you now, after hearing, you're talking about the federal negotiations and where we're at with that, I think I understand the timeline. This fall, we're going to be looking at, we should have the 10 drugs that they're talking about. The only question I have is, will we have a price? So we meet again, the legislature meets again in 2025. Will there be a negotiated price for those 10 drugs by the time they meet again, or is that going to be after they meet?
Kate Marshall for the record. If you're going to talk about school choice, please quote yourself, not me.
Well, I just may use a few things that you're saying because I like what you said.
Anyway, Senator Hammond, it's a pleasure to chat with you. Okay, so the timeline. This September 2023, they choose the 10 drugs. Next September 2024, before the session, they choose the price. And the reason that they're doing it in that way, right, is because it takes time. It takes time, as you have heard from various entities, to then start to negotiate. I did call some hospital associations and doctors' associations prior to the hearing on the assembly side, and they told me that on average those contracts are 3 to 5 years. And so if you're going to now open the contract and say, all right, we have this Medicare negotiated price, and the manufacturer is required to make sure that that medication is available for distribution at the patient level, right? How are we structuring that? And that takes time. In Nevada, we often do studies. I'm sure everyone has their own view about studies. We have an opportunity here to enact this bill, and then in 2 years, should there be certain things that that everyone comes to the table and says, oh, look at this, we have that time, just like the federal government has that time. If we wait until 2025 and then tell Richard Whiteley, oh, buddy, you got 6 months to do it, good luck. I'll let you deal with that. I'll let you guys deal with that. Thank you.
Well, thank you, and thank you for the presentation. Lots to think about. So with that, we will close the hearing on Assembly Bill 1250, and we'll now, since we have everybody here, go to work session. Turn it over to Mr. Magrejo. Please begin.
Thank you, Madam Chair. For the record, Cesar Magrejo, Committee Policy Analyst. I will note for the committee members that Assembly Bill 218 and Assembly Bill 392 have been removed from today's work session agenda and are going to be rescheduled at a later date this week. The first bill is Assembly Bill 110, which makes revisions governing the dispensing and delivery of certain dialysate drugs and devices used to perform dialysis. It was sponsored by the Assembly Committee on Commerce and Labor, and it was heard on April 19, 2023. This bill, among other provisions, authorizes a manufacturer or wholesaler to dispense dialysate drugs and deliver devices necessary to administer dialysis at a residence after satisfying certain requirements to a patient with irreversible renal disease or his or her designee healthcare provider or hospital or facility for the treatment of irreversible renal disease. And Madam Chair, there's no amendments to this measure.
Thank you. Committee, questions, comments? Well, I will entertain a motion to pass. I have a motion from Senator Pazina. Do I have a second? Second from Senator Stone. Additional questions? All in favor, aye. Aye. Opposed, nay. And the ayes have it. Senator Pazina, you want to take this? Thank you.
Thank you, Madam Chair. For the record, Cesar Magrejo, Committee Policy Analyst. Our next bill is Assembly Bill 124, which revises provisions governing the renewal of a license as an osteopathic physician or physician assistant. This bill is sponsored by Assemblywoman Hardy and was heard on April 26, 2023. This bill removes the requirement that the State Board of Osteopathic Medicine annually requests submission of verified evidence for the completion of the required number of continuing education hours from not fewer than 1/3 of the applicants for a license renewal. Instead, the measure requires the board to annually request the submission of evidence from a percentage of applicants determined by the board. And Madam Chair, there's no amendments for this measure.
Thank you. Committee, questions, comments? I'll entertain a motion. We have a motion. Motion to do pass? Amend to do pass. Senator Buck, the second. Second from Senator Scheibel. Additional questions?
So the motion is do pass.
Just do pass. Yeah, that's what I thought. I have a motion from Senator Buck to do pass and a second from Senator Scheibel to pass. Any further questions? Everybody clear? It's do pass and not amend do pass? Okay, thank you. All right. All those in favor, aye. Aye. Opposed, nay. And the ayes have it. Senator Buck, do you want to take the statement, please?
Thank you, Madam Chair. For the record, Cesar Magrejo, Committee Policy Analyst. Our next bill is this Assembly Bill 127, which revises provisions governing Medicare supplemental policies. It was sponsored by Assemblywoman Jauregui, and it was heard on May 1st, 2023. Assembly Bill 127 prohibits an insurer, other person, or entity from varying the commission or paying differential commissions associated with the purpose of Medicare supplemental policies during the open enrollment period, or otherwise treating Medicare supplemental policies purchasing during the open enrollment period differently for the purposes of commission for any reason. In addition, an insurer, other person, or entity must treat the purchase of a Medicare supplemental policy during open enrollment period in the same manner as a renewal of a Medicare supplemental policy for purposes of paying a commission. And Madam Chair, there is one amendment from Assemblywoman Jauregui, which is to amend paragraph C of subsection 4 of section 1 to delete age. And that's all the amendments.
Thank you. Committee, questions? I'll entertain a motion. I have a motion from Vice Chair Lang, amend to pass. Do I have a second? Second from Senator Daly. Additional discussion? All those in favor, aye. Aye. Opposed, nay. And the ayes have it. Senator Hammond? Yes. Yeah. I know you were trying to look away, but.
Thank you, Madam Chair. For the record, Cesar Magro, Committee Policy Analyst. Our next bill is Assembly Bill 223, which revises requirements relating to collection agencies, sponsored by Assembly members Carter and Anderson et al. This bill was heard on May 8th, 2023, and this bill requires a collection agency to provide without charge a debtor with a payoff letter concerning a claim that is owed or asserted to be owed by the debtor not later than 10 business days after the debtor requests a letter, or a satisfaction letter concerning a claim that is owned or asserted to be owned by the debtor not later than 5 business days after a claim has been satisfied. A debtor aggrieved by a violation of the requirement to provide a payoff letter or satisfaction letter may bring a civil action against the collection agency that committed the violation. The measure also removes the requirement that the collection agency, before collecting a medical debt, send written notification containing certain information to the medical debtor by a registered or certified mail, and there are no amendments to this measure.
Thank you. Committee questions, comments? I'll entertain a motion. Motion from Senator Daley. Do I have a second? Second from Vice Chair Lang. Additional questions? All those in favor, aye. Aye. Opposed, nay. And the ayes have it. Senator Scheibel.
Thank you, Madam Chair. For the record, Cesar Magro, Committee Policy Analyst. Our next bill is Assembly Bill 298, which revises provisions governing housing, sponsored by Assemblywoman Howdigy, and it was heard on May 8th, 2023. This bill requires a landlord who collects any fee from the prospective tenant who applies to rent a dwelling unit to refund the fee if the landlord rents the dwelling unit to a different prospective tenant and does not conduct the activity for which the fee was collected. Additionally, the measure requires a rental agreement to contain a separate appendix containing certain information regarding fees and the rights of the tenant. In addition, a landlord is prohibited from collecting an application fee to obtain a credit report or background check for a minor who is a member of the household of the prospective tenant. Further, the bill provides that during the period beginning July 1, 2023 and ending on December 31, 2024, a landlord must not renew a rental agreement or enter into a new rental agreement for a dwelling unit with an existing tenant that increases the rent payable in the amount that is not more than 10% of the rent payable to the existing tenant that is in effect on June 30th, 2023, and there are no amendments to this measure.
Thank you. Additional questions, comments? I'll entertain a motion. Have a motion from Vice Chair Lang. Do I have a second? Second from Senator Daley. Additional questions? Senator Stone.
Thank you, Madam Chair. I regret that I won't be able to support this bill because it does impose some rent controls, which I think is potentially going to decrease investment. For those reasons, I will vote no.
Senator Spearman, Chair Spearman, I will be a no also.
Anyone else? Okay, all those in favor? Aye. Opposed, nay? So opposed, Senator Stone and Senator Buck. And Senator Hammond. Okay, the ayes have it. Let's see here. I'll take the statement.
Thank you, Madam Chair. For the record, Cesar Magrejo, Committee Policy Analyst. The next bill is Assembly Bill 401, which revises provisions governing schools of nursing. This bill is sponsored by Assemblywoman Howdigy, and it was heard on May 5th, 2023. Assembly Bill 401 authorizes an approved school of practical or professional nursing to determine the appropriate ratio of faculty members to students for a course that provides clinical training. The ratio must not exceed 1 faculty member for every 12 students, and there are no amendments to this measure.
Thank you. Committee questions, comments? I'll entertain a motion. Have a motion from Senator Pacino to pass. Do I have a second? A second from Senator Buck. Additional questions? All in favor, aye. Opposed, nay. And the ayes have it. Senator Pacino, you want to take that?
Thank you, Madam Chair. For the record, Cesar Magrejo, Committee Policy Analyst. The next bill is Assembly Bill 410, which revises provisions relating to industrial insurance, sponsored by Assembly Members Howdiggy, Yeager, O'Neill, and Monroe Moreno, and it was heard on May 10, 2023. This bill expands the stress-related injuries that may be compensable under industrial insurance in certain circumstances to include a mental injury afflicting a first responder that is caused by extreme stress for which the primary cause was witnessing a series of specific events that arose out of and during the course of employment. There is an amendment proposed by Assemblywoman Howdiggy, which is to add Senators Pazina, Spearman, and Stone as co-sponsors to the bill. Madam Chair, that's all the amendments.
Thank you, committee. Questions, comments? I'll entertain a motion. Motion from Senator Pazina. Do I have a second? Second from Senator Scheibel. Additional questions? All those in favor, amend do pass? Aye. Aye. Opposed, nay? And the ayes have it. And I'll take that one too.
Thank you, Madam Chair. For the record, Cesar Magrejo, Committee Policy Analyst. Our next bill is Assembly Bill 415, which revises provisions relating to dispensing opticians, sponsored by Assemblywoman Taylor, and it was heard on May 5th, 2023. Assemblywoman Taylor has proposed several amendments, which are attached to this work session document. The first amendment is to amend paragraph B of subsection 1 and paragraph D of subsection 2 of section 1 to add "and verification" to the definition of ophthalmic dispensing. And a second amendment is to amend subsection 2 of section 21 to provide that the board may accept monetary grants, donations, and contributions from any source for the benefit of the board collectively and not for the benefit of a board member individually to assist in carrying out the provisions of the Dispensing Opticians Practice Act. Amendment number 3 is to delete section 23 of the bill, which would have revised provisions relating to the confidentiality of certain information maintained by the board. Amendment number 4 is to delete subsection 6 of section 29, which would have required the board to cooperate with or provide any documents or information to any other licensing board or agency, including a law enforcement agency that is investigating a person licensed pursuant to the Dispensing Opticians Practice Act. Amendment number 5 is to delete subsection 7 of section 29, which would have made an order of the board that imposed discipline and certain supporting information, public records. And the last amendment is to amend subsection 8 of section 29 to revise that the actions that constitute unprofessional conduct. And Madam Chair, that's all the amendments.
Thank you. Committee members, questions, comments? I'll entertain a motion to amend do pass. Do I have a motion? Motion from Senator Daley. Do I have a second? Second from Senator Pazina. Additional questions? All those in favor, aye.
Yes.
Senator Stone.
I'm sorry, Madam Chair. I just want to thank the proponents for working with me on the gifts that could have been provided to the board. I really appreciate their amending the bill, and with that, I'm happy to support it as well. Thank you.
Additional comments? All those in favor, aye. Opposed, nay. And the amendment and the bill passes. Congratulations. So, Vice Chair Lang, you want to take that? Okay, thank you.
Thank you, Madam Chair. For the record, Cesar Magrejo, Community Policy Analyst. Our next bill is Assembly Bill 437, which limits the amount the provider of health care may charge for filling out certain forms associated with certain leaves of absence. This bill is sponsored by Assembly Committee on Commerce and Labor and was heard on May 1st, 2023. There is an amendment attached to this work session document proposed by Jessica Ferraro, representing the United Food and Commercial Workers, which is to amend Section 1 to prohibit a provider of health care from charging a person more than $25 to a new patient for completing employer-required FMLA certification forms, and to require a provider of health care to provide such forms at no cost to existing patients. And Madam Chair, that's all the amendments.
Thank you. Committee members, questions, comments? I'll entertain a motion. Amend to pass. Have amend to pass from Vice Chair Lang and have a second from Senator Daley. Additional questions? All those in favor, aye. Opposed, nay. And the ayes have it. Let's see who hasn't gotten one. Senator Stone.
Thank you, Madam Chair. For the record, Cesar Margarejo, Committee Policy Analyst. Our last bill on the work session agenda for today is Assembly Bill 442, which revises provisions relating to persons licensed by the Board of Medical Examiners. This bill is sponsored by Assembly Committee on Commerce and Labor, and it was heard on May 5th, 2023. Assemblywoman Peters did propose several amendments to this bill, which were discussed during the bill's presentation, and which are to delete sections 1 through 3.5 of the bill as drafted, add a new section to the bill to amend Chapter 629 governing healing arts generally, to require healthcare licensing boards to take certain actions in response to complaint alleging that a person licensed by a board has committed any act which, if proven, would constitute domestic violence or sexual assault. Add a new section to the bill to amend Chapter 629 to require each healthcare licensing board to adopt regulations setting forth circumstances under which it is required to summarily suspend the license of a licensee in response to a complaint or a series of complaints against the licensee. And the last amendment is to add a new section to the bill to require the Joint Interim Standing Committee on Commerce and Labor during the 2023-2024 interim to create a working group to study issues relating to sharing information between law enforcement agencies and certain professional and occupational licensing boards concerning licensees who are under investigation for alleged acts which, if proven, would constitute sexual assault or domestic violence. Madam Chair, that's all amendments.
Thank you. Committee, questions, comments? I'll entertain a motion, amend to pass. I have a motion? Amend to pass from Vice Chair Lang. Second? Anyone? Second from Senator Daly. Additional questions? All those in favor, aye. Opposed, nay. Have one nay from Senator Buck. Okay, but the ayes have it and the motion passes. Senator Scheibel, no, Senator Stone, how about you take that? Okay, thank you. All righty. That ends the work session. We're going to be doing marathons from now on, and we'll try to get them done at the beginning, but if we have members who have to testify at other places, that won't happen. So now, I'll open the hearing on Assembly Bill 439. The measure revises provisions governing certain contracts of insurance. 'Tis the season. Welcome, Mr. Cockburn.
Hi, Jamie Cogburn with the Nevada Justice Association. Thank you for hearing this. We did submit a slight amendment that is up on Nellis that clarifies who is an insured person under the contract. Originally, it said the named insured or any other person, and we changed that to just be any person insured under the contract, so just a slight clarification. This bill, the purpose of the bill is to give the insureds in a health insurance agreement a voice and choice. This bill only addresses arbitration agreements between health insurance companies and their insureds if there's a disagreement. As most people know, us as consumers really have little choice over who our health insurance carrier is. It's either provided, most of it's provided by your job. So you have no choice. You have no choice to say, hey, I don't want to do this. I don't want to arbitrate and negotiate that clause. Accordingly, this bill amends the statute to say, hey, you can go to arbitration, but just can't be binding arbitration. You have the right of other options available to you. Ultimately, consumers are at the mercy of their health insurance. The Lieutenant Governor earlier, gave a heartfelt speech about her issues, and some of that was insurance related. It was whether the disputes that can come up are, is this covered under insurance, is this not covered under insurance? And many treatments are extremely expensive. Sometimes you have to go out of state. And if you have that dispute, you're stuck going to arbitration as it stands if there's an arbitration provision. And when you look at the arbitration process, in these agreements, usually, in about 90% of them, the health insurance company has created an arbitration program and they fund it 100%. And so you have to ask yourself, if they're funding it 100% and they're essentially the pure resource for that company to do arbitrations, which way are those arbitrators going to rule? So this it levels the playing field somewhat, and at least gives the consumer the choice on how they proceed forward. And with that, I would open up to any questions that anyone has.
Thank you. Questions, Senator Daly?
Thank you, Madam Chair, and thank you for the presentation and testimony there. So we want to eliminate the arbitration as a dispute resolution process is essentially what it does, at least as a binding method. So without it being binding, I don't know why you would engage in it. So are people going to end up going to court more often, or is there going to be, I suppose there's potential for mediation versus arbitration and various things. How often do you think it's just going to skip over everything and go to court?
Thank you. Jamie Cogburn, for the record, through the chair to Senator Daly. That is a good question. I actually don't think what it will do, I don't think it will increase the number of lawsuits. I will tell you that. What it will do is allow a consumer to say, hey, you know what? We can do non-binding arbitration, which ultimately you'd be better off doing mediation, in my opinion, but you do have the right to do a non-binding arbitration. But it allows you to say, as a consumer, I would like to use a fair arbitration company. So the biggest one is probably JAMS. And I would like to be able to have a say in who the arbitrator is. I would like us to be subject to certain regulations and rules, not just a arbitrary arbitration clause that's in a contract. Although the consumer would have the right to skip over arbitration and say, hey, I want to sue. I don't think that will happen very often, except in egregious cases, but the consumer would have that choice.
Follow up. Thank you, Madam Chair. And I understand, I think, so the consumer could say, hey, I'm still going to do arbitration. I'm still going to do and agree to binding arbitration. Of course, advice of counsel and all that stuff's going to be in play. But instead of saying, we're going to go through your arbitrary process where you have selected already arbitrators, we're going to go to the FMCS or the I think it's AAA, whatever it might be, I forget the acronym, and get a panel of arbitrators on each side can strike. That would be agreed to. It wouldn't be in a contract, but it would be agreed to if you went to the alternative resolution. And I agree, mediation, probably the better road.
Thank you. Jamie Cogburn, for the record, through the chair to Senator Daly.
Just go direct.
Thank you, Chair. That is correct, Senator Daly. You would still have the option to say, hey, we do want to do binding arbitration. There is no doubt that many times arbitration is quicker. As a practicing lawyer, we will sometimes stipulate to arbitration because we wanted something expedited, as long as certain parameters are put in place that we feel are to make it fair. Each side gets to strike an arbitrator, and we feel it's a fair process. And that is the purpose behind the bill.
Final follow-up, Madam Chair. So this just eliminates say, hey, we're going to go to arbitration. The insurer can't say, oh, great, we already have our process, and this is what you have to use. So if you're going to do that, they would have to then enter into some dialogue to agree on the arbitration process and who the arbitrators are and how they're selected in order to do that. So it wouldn't just be one-sided. That's already negotiated in a contract between an insurer and a provider, however the process works. So anyway, I think I understand that. Thank you.
Jamie Cogburn, for the record. That is correct, Senator Daly.
Senator Stone?
Thank you, Madam Chair. Thank you for your presentation, Mr. Cogburn. Can you share with us federal law? And is there a federal preemption here that you may be discounting?
Thank you, Senator Stone. Jamie Cogburn, for the record. The original bill format, there was going to be a federal preemption issue that makes it subject to the FAA. We amended the bill and struck out many of the other arbitration provisions requiring that it be non-binding. But under the McCarran-Ferguson Act, that says that the business of insurance is not subject to the FAA, and that's been upheld among circuit courts. And so that, we don't believe, will be subject to preemption and subject to the FAA, which is the Federal Arbitration Act.
Additional questions? So I just have one, is maybe question, comment. So, and I'm following up on Senator Daly's. So sometimes when you go through arbitration or something that looks like that, there are additional facts that are revealed. So could that be a byproduct of making sure that the insured has an opportunity to present their side of the story unfiltered?
Jamie Cogburn for the record. Somewhat, yes, Chair. If you went through a non-binding arbitration, facts could come out in testimony. What, in my experience and what most people have experienced is certain arbitration provisions really limit the amount of discovery you can do. So they say, hey, you can do 10 questions, you can take one deposition, or you can't take any depositions. So it becomes very hard to uncover certain facts. And when you're stuck to a arbitration agreement that you had no right to negotiate, it was just in there, you're stuck with that. And this way, that can be negotiated. You can say, hey, I'm fine doing binding arbitration, but let's do it pursuant to the Nevada Rules of Civil Procedure, which, okay, you could have 7 depositions, you could do certain things, or 10 depositions, you can do certain things. That is really the point. It levels the playing field. It allows you to do discovery, and it allows the consumer a choice.
Okay, thank you. Any other presenters? Okay, if you'll step back, we will open up public testimony now in support. Public testimony in support. Don't see anyone moving to the table here or down south. Do we have anyone on the phones, BPS?
If you would like to testify in support of AB 439, please press star 9 now to take your place in the queue. Public line is open and working. There are no callers at this time.
And thank you. So we'll move now to opposition. Anyone here? Carson City in opposition. Anyone in Las Vegas? And so we'll start up here. Carson City, opposition 439.
Thank you, Madam Chair, members of the committee. My name is Helen Foley, and I represent the Nevada Association of Health Plans, and we appreciate the opportunity today to provide comments on AB 439. We are concerned about this issue. Nevada Association of Health Plans is a statewide trade association representing 10 member companies who provide commercial insurance, health insurance, and government programs to Nevadans. Our mission is to ensure the growth and development of a high-quality and affordable health care delivery system throughout the state. We share the following key points from AT&T Mobility LLC versus Concepcion as verification of a federal ruling that states that we are preempted from passing laws that eliminate or limit arbitration clauses. The Federal Arbitration Act has been law since 1925 in response to judicial disfavor towards arbitration agreements. Section 2 of the Act provides a written provision in a contract evidencing a transaction involving commerce to settle by arbitration a controversy thereafter arising out of such contract or transaction shall be valid, irrevocable, and enforceable, save upon such grounds as exist at law or in equity for the revocation of any contract. It goes on to say, in line with these principles, courts must place arbitration agreements on an equal footing with other contracts and enforce them according to their terms. So when state law prohibits outright the arbitration of a particular type of claim, the analysis is straightforward. The conflicting rule is displaced by the Federal Arbitration Act. When we heard that Mr. Cogburn discussed some of these issues and that we would still have the right to do these things and that now, under the new amendment, it would no longer be unconstitutional, I can't find that anywhere in his proposed amendment. So we do have a problem with this, and we look forward to collaborating with you and others in the committee to hopefully resolve this issue. Thank you.
Good morning, Madam Chair. For the record, Trey Abney here representing AHIP, America's Health Insurance Plans nationwide trade group, of course, for health plans. I want to associate myself with all of the comments that Ms. Foley made. As usual, she's much more articulate than I am. But, in addition to that, we are always concerned about the cost of health care. You spent almost 2 hours in this room this morning talking about the increasing cost of healthcare and the difficulty of affording that, which means we are always concerned about any bill that would open up our members to more lawsuits. In general, I think you will find historically that anytime you open up any type of business or transaction open to more lawsuits, it does not result in lower costs. And it's not just that one client or patient that is having that issue, but that it goes through the entire system and could increase cost on everyone. And for those reasons and the reasons that Ms. Foley stated, we oppose this bill. Thank you.
Thank you. Don't see anyone in Las Vegas? BPS, anyone on the phones?
If you would like to testify in opposition to AB 439, please press star 9 now to take your place in the queue. The public line is open and working. There are no callers at this time.
So we'll move now to those in testifying neutral. Assembly Bill 439. Don't see anyone moving to the tables. BPS, anyone on the phones?
The public line is open and working. There are no callers at this time.
Thank you. Mr. Cogburn, closing comments? Okay. And so with that, we will close the hearing on Assembly Bill 439, and we will open it up now for public comment. And reminder to those who would make public comment that it's 2 minutes, and we do not comment on any of the bills that we heard today, but it can be something other than that. So 2 minutes. Anyone here? Carson City? Anyone? Las Vegas? BPS, anyone on the phones?
If you would like to provide public comment, please press star 9 now to take your place in the queue. The public line is open and working. There are no callers at this time.
Oh, so thank you, and thank you, committee members, for the marathon, and we will keep this up until the 19th. So with that, we will adjourn and see you back here on Wednesday at 8 o'clock. We are adjourned.